Good afternoon, and welcome to our faculty staff forum on the Big Red Restart. A year ago, none of us could have imagined being where we are today. These are unusual times for all of us, and yes, they're challenging as well. I don't have to tell you because so many of you have been involved. So much has been done during the summer to prepare for our reopening this month. I can't say thank you enough to everyone who served on our restart committees. Hundreds of hours of research, dialogue, questioning, planning, all of this work has prepared us and served us well to restart. And the work underway by each of our faculty and staff is simply remarkable. Now, with 3 weeks before our Big Red Restart actually becomes reality, we're going to take some time to answer your questions and to ensure that you, our faculty and our staff, have the information you need and that you feel fully prepared for 3 weeks from today. Several of you have asked, yes, we're going to record this, and we know that there are some conflicts, and so we'll post it tomorrow so folks who could not participate today can view it at a later time. This will be posted on our new site, wku.edu/healthy-on-the-hill. Joining me today on the panel are David Oliver, Emergency Manager and Director of Environmental Health and Safety, Ethan Logan, Vice President for Enrollment and Student Experience, Susan Howarth, Executive Vice President for Strategy, Operations, and Finance, Cheryl Stevens, Provost and Vice President of Academic Affairs, Lynn Holland, Assistant Vice President for Student Life and Dean of Students, Mike Riegel, Assistant Vice President for Student Engagement and Executive Director for Housing and Dining, Brian Russell, Chief Facilities Officer, and finally, Todd Stewart, our Director of Athletics. Now, we will begin today by addressing those questions already submitted. And if you haven't yet submitted a question, it's still not too late. If you send us a question to forum.questions@wku.edu, we'll be receiving these during the course of the forum. Enough of the beginning, let's get started. Because so many of the questions we received centered on the need for clarification around testing, contact tracing, and quarantine, I'm going to turn it over to David Oliver for a minute to take some time to walk us through all of those procedures. David?
Thank you, Dr. Devine. I wanted to walk through today some of the key elements that we've put into our plan around the case management of potential COVID cases, which includes, as Dr. Carboni mentioned, testing, contact tracing, quarantine, etc. I'll first like to thank our partners in putting this together, and that is Grace Gilbert Clinic, who has our clinic on campus, Medical Center Health, the Bear River District and Kentucky State Health Departments have all come together to help us assure that our plan is solid and is in place based on the conditions that we face with this disease. First of all, we have procedures in place for daily health checks. And I think this is a very important thing to mention for every faculty, staff, and student. Before you come to campus, before you leave your dorm, is to make sure that you check to make sure you don't have a fever or other symptoms of COVID-19. If you do, we want you to stay where you are and consult for your medical provider or Grace Gilbert Clinic. We're also finalizing a policy that deals with protective measures around like face covering, social distancing, our disinfecting practices that are around the campus. And I think it's important that will be posted later this week, but those things are in place now. We are going to require face coverings. Whenever you're inside a building and all the common areas and even outdoors, if you cannot maintain social distance, all of those guides are on the website. To the point of testing, we are providing access to testing on campus for faculty, staff, and students in accordance with our public health partners and our physician guidance. Testing will be available if you have symptoms that are consistent with COVID-19, if you've had close contact with someone who has tested positive for COVID-19, if you've been contact traced, in other words, public health has notified you that you've had a potential contact, or if a physician orders a test based on risk factors, or ahead of a medical procedure. All of those criteria will allow you to have a test. The testing costs will be covered for faculty, staff, and students throughout the duration of the healthcare emergency. A little bit about contact tracing. The Public Health Department in Kentucky will conduct all contact tracing. They have dedicated staff to higher education, specifically to WKU, for this effort, and we will support their efforts in working through potential contacts. They will make the contact to anyone that they feel is at risk based on their contact tracing investigation. A little bit about what constitutes a contact, and that is you need to be within 6 feet of an individual who has tested positive for COVID for at least 15 minutes. This is the reason, based on the CDC guidance for social distancing, and the reason we're doing what we are doing in classrooms and other areas of campus to maintain that social distancing. And if all those things are followed, the likelihood of having a contact with someone is very minimal. We also have medical case management available through Grace Gilbert Clinic on campus. As always, you can work through your personal physicians or other healthcare providers, but we have GGC here to provide case management and assistance to any faculty, staff, or student. We've also designated a team that's tied, many of them from my department, human resources and athletics, that are together, that are going to be active supporters of case management across the campus. Work very closely with housing, residence life, and others in that area. To that point, we have developed a quarantine plan for all students that are living in on-campus housing. The plan includes provision for quarantine for both symptomatic and asymptomatic students, and also for those that have been contact traced by public health. We have support mechanisms tied into that for delivery of meals, healthcare, counseling, as well as academic support to make sure that this quarantine period does not result in the isolation of anyone in this process. Lastly, I'd like to talk about data related to the COVID-19 on campus. We do have a dashboard that is on the Healthy on the Hill site, and that dashboard will be updated weekly, and it will provide data on cases, as well as some demographic data of where those cases, the groups that they're from, as well as the number of PCR tests that we've conducted on campus. Hopefully this information will help you in guiding through this. And if you have additional questions, we will be glad to answer them on an ongoing basis.
Thank you, David. And let me address a little bit of that as well. There may be questions about why we're doing this and not doing something else. We've spent hours after hours after hours working with healthcare professionals, locally, regionally, at the state level, and professionals who work with us year in and year out to build these protocols. I know there may be other ideas that folks may have. I'm also pleased that all but one of our sister institutions have built the same plans. And so I'm confident that we've done all we can do following the CDC guidelines and working in conjunction with our partners to create as safe as possible a campus as we can. But I want everyone to hear this from me. There is not a risk-free environment. There will be COVID cases on this campus, and our job is to identify them, isolate them, contact trace them as quickly as we can. And that takes everybody, the entire community, engaging on it. As you go through the semester, if you need professional help, it's available 24/7. And all you have to call is 270-745-2019. Or if you just prefer to email, it's covid.help@wku.edu. So Susan, the first question that we have that came in over the weekend is for you, which says, how often will our health insurance cover testing?
So sure, President Caboni, we did confirm with our health insurance provider, Anthem, that there is no limitation during this health crisis to the amount of testing any individual chooses to ask for.
So it sounds to me like if you want a test, you can go get a test, which I think is a good thing for all of us. Next question I'm going to take. It's what metrics are you watching to determine whether it's still safe to restart in person? What conditions would cause us to no longer start in person? And what conditions would cause us to move from in person to online only once the semester starts? We're looking at a range of data, and all of this is data driven. So I'll give you an example of what those data might look like. The positivity rate in our county and in our state is important. You'll be happy to know that has gone down for the past several days. The number of positive cases average per 100,000 people in an area. We're looking not just at the state, but also at Warren County. Again, positive news that those have trended down in the past several days as well. So we're looking at health metrics combined with other things in the region and the area that we want to pay attention to. Number one, can we continue to isolate folks as necessary? Do we have the space to do that? Number two, what's the health capacity of our system here in Bowling Green? Do we have beds available if necessary? And has that been overwhelmed? Number three, how about contact tracing? Do we have the ability to continue to contact trace? And all of this in the context of the guidance that we're getting from the governor's office and across the state. So there is not one metric we would use to pull a trigger or a lever. It's a holistic decision based upon all of those metrics, and we make it in concert with the rest of the coronavirus task force. So thank you for that question. Ethan, will students moving to campus from out of state, particularly hotspots, be asked to quarantine for 14 days before participating in classes and campus life?
Thank you, sir. We are going to request that our students consider self-quarantine 14 days prior to return to campus, especially if you're coming from a state which is considered by Kentucky to be a hotspot based on the number of coronavirus positive testing results. It is a good practice and a solid consideration for all students, especially as you travel from outside of Bowling Green to come back to campus, to have a period of self-quarantine, both for your own benefit and for the benefit of the community when you return.
And if I recall correctly, we emailed those folks from hotspots asking them to do that quarantine just last week. Are there, I'm going to stick with you, are there alternate working arrangements available for student employees who depend on their campus jobs to be able to attend school, but who are at risk? I'm terribly worried about one of our students who's an RA and has an underlying health condition that puts her at higher risk of COVID.
Student employees, just like our employees on campus, all employees on campus will work with in terms of their scheduling or the adaptation of their work. Specifically, if it can be transitioned to a remote aspect, that's perfectly allowable and something that we'll consider. In cases where student or public contact is imperative to the work and a student does not or is not quite comfortable to do the work in a public setting, then we'll work to find another alternative working arrangement for them, maybe in a different department.
Great. We'll stick with you for a third question. So when school resumes, are student workers able to come back in the office, or should we keep them working remotely?
As we resume, our focus specifically in our division of enrollment and student experience has been to focus on making sure that we're open to the public. So I would ask that our students who are student workers come back to the offices to work in the other offices to help with the facilitation of the public interaction and exchange that we provide. Now, we'll do that in context of also making sure that we're controlling for the density and the proximity of people and personnel, so that we won't have all staff on all the time. We'll make sure that we are working in an environment that is controlled, and contained, and of low density. And so students will be asked to come back, but we'll make sure that those arrangements are being in a situation where they are a part of the solution for how we're going to manage the department in the way that we approach our working conditions. And I'm sure that's the truth for all of our campus partners.
Great. Thank you, Ethan. That's not just for student affairs, but for all of our academic units and anyone else who uses students. Just like with the rest of your employees, want to make sure that you're providing that flexibility as we go throughout the semester. We are getting some live questions coming in, talking about more of an explanation of why we're not testing everyone before they return to campus. As I mentioned before, we are collaborating and cooperating with our local health professionals, with folks at the state level, including Dr. Stack and the governor's office, And we think that there are several reasons why you wouldn't test everyone before they came. And this has been through many hours of conversation around why we're pursuing this level of testing. The first of which is a test is a snapshot. You only know that you are not positive at that moment. And even though you may receive a test that comes back as negative, number one, you may have other engagements after that test, but before you arrived on campus or even after you arrived on campus, where you might contract the virus. So that's number one. Number two, the way in which this test works, particularly in early times of exposure, it actually has a high negative rate. And so the experts have suggested that just testing everyone really doesn't give you a sense of whether they actually have or don't have that virus. Really, symptomatic presentation is a better example. Number three, if you think about when it is you might feel if you got a negative test back. There are some professionals, and makes sense to me, that are concerned that that would give you a sense of safety when you shouldn't feel safe, and might embolden our students to feel more confident and not follow all the guidelines that we have in place. So that's a little bit more complexion for you on that. Related to students and student behavior, Lynn, would you talk a little bit about this question, which is how are we working to help influence student behavior to keep us all safe?
Well, there's a couple of, thank you for the question. There's a couple of things that I'm really excited about that we have set in motion. One, if you recall, we have the WKU Creed, which has been a document that we have been using for decades now to convey to students what we expect from them as they join the Hilltopper community. That document begins with information on that you're a member of this community, that you have both individual and you have an individual commitment, but you also have a commitment to other people in the community to adhere to a particular set of expectations. So in addition to the creed, from that, using that as a foundation, we created, or the process of adopting, the Hilltopper Pledge, Hilltopper Healthy Pledge. And it borrows language from the creed, but in addition to that, it elaborates on what we expect students to engage in, the behaviors that we expect them to participate in while they're here. The other thing, and this is, I'm really excited about this. So we have been in the process, of course, for several months, as President Camboni has indicated, and so many others have indicated, thinking about how do we go about creating an environment where we can mitigate risk. And from that, we've realized that we've been doing a lot of conversations amongst ourselves. But finally, we realized, well, there's a voice that's missing. And even though we had members of SGA on the COVID task force, members of other organizations, we decided to create a student COVID task force, which is just in the formation stage. We've had input from students on what our processes should look like, particularly as it relates to norming of behaviors. So the student COVID task force, and right now there are about 30 individuals who have been asked, who have been nominated to participate on that task force. Those students will be influencers. We understand that data is very clear. Peer-to-peer influencing is critical to help us in creating the behaviors that we want. So those individuals will operate as influencers. They will also help us sculpt a communication plan to carry out the semester. This isn't just a one-time thing, but to carry out through the semester on the behaviors that we are looking for. In addition to that, those folks will help us look at our restart plan from where they sit, from the perspective where they sit, and help us make changes as we go along that certainly puts the students at the forefront. So those are just some of the things that we've set in motion.
So one of the things that, and I'll add a little bit there, is that we can either do this with carrot or with stick. And I think we have a good mixture of both of those in the restart plan. The idea that a policy will have sanctions built in, but what we really want to create for community is the expectation that each of us will do our part. And that means every student, every faculty member, every staff member who comes into a building will wear a mask. And that's just the way we're going to have to be and exist until this virus passes. And part of that is creating the norm and the expectation of what happens if you violate that norm. And there's a question later, and we'll spend some more time on that. But I think it's important for each of us to set an example. It's one of the reasons you see us sitting 6 feet apart, each in a mask. This is the way we're going to have to work for the foreseeable future. And the sooner we can get folks comfortable with that and comfortable with the difference, I think the better we're going to do. I'd like to shift a little bit now to Susan Howarth in her role with Human Resources that reports to her. I have a question around staff who have school-age children where school is not in session or NTI is being done. Will those staff have the capability to continue to work from home and or rotate through the office? Susan.
Yes, I think it's really important. President Caboni and his leadership team has made it clear to all the deans and vice presidents over the past months that we have to remain as flexible with our staff. And certainly for those staff or faculty that have children that are having to learn from home, that we be flexible and allow them to be at home with their children during this time. Again, we all want to be as flexible as we can with our staff and our faculty during this time. So if there's ever an issue that your department lead has problems with that, they need to get with their healthy at work officer so that we can resolve those problems.
Thank you, Susan. One more student-oriented question, this time around dining. It comes from one of our music faculty asking, how will dining lines between classes be managed for students to get food? Music students typically have back-to-back schedules on certain days. Before COVID, I've had my students text their friends to wait in a line for them until they get out of class so they can then get their food in time to eat and make it to the next class. Is there going to be an app that will be used? And if so, when will it be available and announced? Ethan, what are our plans there around dining and wait times?
We definitely have been working on the design for dining and dining access for students and faculty staff on campus. A lot of attention is being made to the way that people queue for food, the way food is presented and it's outlaid in terms of how we can space people around food venues for pickup, and a lot of focus on grab and go options so that we can facilitate the ease of transition without the prolonged exposure of people in a contained space. So there's been a lot of attention to the way that dining is going to evolve for this next year in our foreseeable future, and the way that we really try to work on adaptation. I don't know if we have an app for that yet, but that's definitely something that we will look into and see if we can coordinate with our partners with Airmark. It would be nice to be able to phone in. That's an antiquated term to provide use an app to reserve a meal for pickup.
Provost Stevens, here's a question for you. The current plan indicates that health-related absences like quarantine, quote, may not negatively impact, end quote, students academically. What protocols are being developed by the university to help students keep up with their classes?
Well, it's not really about protocols, it's about practice. And we have always worked with students who are not able to come to class for a variety of reasons to make sure that they did not suffer academically. And in that same regard, the first thing a student should do if they are not able to come to class is contact their faculty member and talk to them about alternatives. That faculty member should work with them to identify the materials they need, to help them get them, to give them access. And if it's help they need beyond that, there are student support services that could help them, put them in touch with additional support through the Division of Enrollment and Student Experience.
Okay, thank you, Cheryl. And we're going to take a live question coming in over the interwebs. And I'll stick with you, Cheryl, for this. So what should department staffing and hours look like beginning on 8/24, the first day of classes? For example, this questioner asks, should office staff, department head, and student workers rotate their hours in the office and working from home to allow less contact time?
So initially, when students first come to campus, I think that it's important that we have reasonable availability in the various departments. We always know that new students come to campus, they don't know where to go, they can't find their class, they're having trouble with logistically navigating campus, and they need to talk to somebody. And that means when they walk into the office, there's got to be somebody to talk to, somebody knowledgeable, not just somebody who will take a note. You know, they might be looking for a class, they might be looking for a faculty member, they might need to add something in TopNet, and that has to be done in a timely way. So I would say, at least initially, there should be department heads and office people who are there to support them. As things settle down a little bit, certainly people should be able to work from home as appropriate, which I think is perfectly reasonable.
And that's for academic departments, but for other departments as well. Remember that part of our goal at keeping folks safe and increasing distance is to de-densify campus, not just in the classrooms, but making sure we're taking advantage of the flexibility afforded to us with technology now to allow some folks to work at home, other folks in the building, so that we keep fewer people on site, which means fewer people on campus, fewer people in the hallways, fewer people using the facilities. Cheryl, let's stick with you. Another question. This one comes from Owensboro. I teach IVS in Owensboro in the evenings. Given there is plenty of room for the small number of students, can I assume I will be teaching on site as usual?
If the course was set up as an on-site face-to-face course and you haven't negotiated a different modality with your department, then I would assume that it is going to be face-to-face. To confirm, check TopNet, should be listed there.
Great. And one final question, and I will answer a little bit of this before I send it to you. Has WKU considered utilizing the Master in Public Health and/or nursing students to any capacity? I am aware, I've had a conversation with at least one of our graduates from the public health program, who I know is one of the new contact tracers for our local health department. So I know our alumni are engaged in this effort, but how about current students? We had that conversation.
Students are continue to be involved in clinical study, external relationships with various companies. That's what we do because we are that engaged student experience university, right? So we want our students to continue having those experiences. There is, however, absolutely no expectation that they would work with COVID positive people.
Very good. Next question is around what measures are going to be taken for large events such as homecoming, fall graduation, family weekend, home sporting events, etc. These events seem particularly high risk, and I'll take this one. Yes, these do seem particularly high risk when you think about community spread of the virus, and what the governor has suggested is that even at home today, that we limit our gatherings to 10 or fewer people. So the notion of having tens of thousands of people or even thousands of folks coming to campus right now is challenging. And so we have not made any decisions about those events. We continue to plan for them and work toward being able to execute football games, other athletic contests, but also family weekend, commencement, other homecoming. But just like everything else that we're doing as an institution, we're going to have to learn to think differently about how we might execute those events. Given all of the uncertainty, we've intentionally delayed decisions as close to that decision point or when you need them as we can. And so I don't have any additional information to share on those other than we continue to monitor it closely, pay very close attention to what the governor's and the guidance is. And as we get closer to those larger events, we're going to have obviously more to say about them. But I agree with the questioner there. These are things that we're taking a very close look at. A live question. Actually, we're gonna, this is very similar to another question. I'm gonna hold off on that one until we get to teaching and COVID. Keeping on along that notion of large events. The next question is, are there gonna be sports games? And if so, are they still gonna be free for students? Todd?
Yes, thank you. Yes, there will be sports games. Right now, we are planning on playing all of our sports seasons this year. And any student with a valid student ID will be admitted exactly as they have been in the past. As Dr. Cavoni alluded to before, we don't really know what the exact capacity will be for every sporting event. That will be determined by our local health officials and also based on guidance from the NCAA. And we'll communicate that as we get closer to each game.
The next, thank you, Todd. The next question, a large number of students come through Jody Richards Hall every hour. How do we manage social distancing guidelines and identify students who may be running fevers? Well, I'm going to take the last one on that. If you're running a fever, hear this from me. Stay home. Don't come to campus. Don't come to work. Don't come to class. Stay home. Stay in your room and contact that COVID hotline, because what we want from you is to get a test. If you have a fever, that means you're symptomatic, and we need to make sure that you're not going to be spreading the disease. But on the first part of that question around the number of students who come through Jody Richards Hall, Brian Russell, why don't you take that one?
One of the requirements that we have is to wear a mask. And one of the things is when we're outside or passing through a hallway or getting into an elevator, if we have our mask on, sometimes we will be closer than 6 feet. But one of the other recommendations is to maintain a 6-foot distance. So as Lynn Holland said, respect is a big part of what we're going to do together to reduce the spread of COVID-19. And so either pause, wait before you go through the door, but just walking across the lobby or commons area of Jody Richards should not pose any issues with our students.
And if you are going to get in contact with other students, or you can't maintain that 6-foot distance, slip your mask on, even if you're outside. Susan, here's one around policies and procedures for faculty and staff who test positive for COVID. What procedures will be followed as staff and faculty? And Cheryl, you may want to chime in on this as well. Wait for results of COVID-19 tests. What protocols are being developed to avoid penalizing staff and faculty members who may not be able to work until receiving a negative test result? And this relates to the question that came in live around, I've got a class of 20. If I test positive, what do I do? So Susan, let's start with you and then we'll go to Cheryl after that.
Okay, sure. I think what's important here is that we are working towards documenting all of these procedures. Circumstances are changing daily, but the one thing that I can assure our staff, and I'll let Cheryl address faculty, I think it's the same. I think she'll probably echo what I'm saying, but if a person is waiting for results, the test results, we will certainly not penalize them from they are allowed to stay at home and quarantine until they get the test results. And then again, I think it's just imperative for our managers to be as flexible with our workforce as possible. We need to have office coverage, that's for sure, but remaining flexible. There are people that are afraid to come to work. I think that it's our managers have to work through this and be sensitive to the needs of the workforce. So there will be no penalty for having to stay at home until you learn that you're healthy and that you're safe. So Cheryl, would you like to say anything around faculty?
A faculty member who thinks they might have been exposed and has had a test, or who has tested positive, should feel free to work from home. If they're teaching a face-to-face class, they should feel free to pivot to an online delivery for the amount of time they need in order to determine whether they're ill or not. At that point, if they can continue to teach because they're low symptomatic or asymptomatic, then they can continue to teach from home, online, until they're better. If they're ill beyond that, need hospitalization, really can't work, they should contact their department head. In either regard, they should let their department head know, and they can work on finding a substitute for that course.
So I want to reiterate what we said in the spring semester. that we have to be flexible, we have to be nimble, and we don't want anyone hurt because we're managing through a once in a century pandemic. And I think if you looked at the way in which we managed through the spring semester, even though going remote was really challenging for the entire campus, what we managed to do was retain the vast majority of our workforce, not to have to let people go or furlough folks. We managed to continue to keep everyone employed. And I think that's really important. You know, if you read and you look at what where the labor market is, you look at what GDP did in the second quarter, I don't want us to send anyone into that labor market to find another position. And so we're going to work together as a community to take care of one another. That means faculty taking care of their peers and staff taking care of their peers, all of us taking care of one another and our students, and even folks in the administration taking care of faculty and taking care of our staff. I have a really specific question around athletics. Todd, the question is around testing. Will WKU shift from antibody testing to PCR testing for athletes to detect and contain outbreaks within that population?
Yes, we will. Good question. And as Dr. Carboni mentioned before, with a PCR test, that's a snapshot of the moment. So what we wanted to do when every athlete came to campus for the first time, we wanted to do an antibody test so that we would gather more information going back a greater amount of time than just that moment. So that's why we started with the antibody testing. As we transition into each team's season, we will have regular PCR testing of all team members.
Thank you. Continuing along with buildings, Brian Russell, this one seems particularly well suited for you. There's evidence that suggests that buildings with poor ventilation exacerbate the spread of COVID. What is WKU doing for classrooms to improve ventilation, especially as many classrooms, this question suggests, have inconsistent air conditioning?
The facilities department for Western has been back on the Hill since early May, and we never stopped doing our preventative maintenance or our corrective maintenance to our building systems. So to ensure the maximum ventilation for all spaces, those protocols are in place, and we continue to do that as things come up in our facilities to ensure we have maximum ventilation in those rooms.
Right. Thank you, Brian. The next question is regarding mask requirements. When a student enters a classroom, a dining facility, or a computer lab without a mask, how is management to deal with the situation if the student simply doesn't want to wear one? I've said on several occasions, hashtag wear a damn mask, and I don't suggest that you say that to the student, but that's what we're shooting for. Essentially, is the expectation is that each of us will take care of one another, will do what's necessary, and make sure that we each have a responsibility that we're fulfilling. I will tell students when they arrive on campus and we begin our orientation and master plan that thousands of people have worked tirelessly to create an opportunity for us. But for us all to have the chance to come back and fulfill our institutional mission, each one of us, every faculty member, every student, every staff person, every visitor to campus is going to have to do their part. And that starts with wearing a mask. But it continues with staying 6 feet away from folks and finishes with good hygiene and washing of hands. If our students can do that, if we can do that as a community, what we know is we can stamp this virus out. I wish we would do that as a county, as a state, and as a nation. We can only control what we can control, but that's going to be part of the conversation, that you're going to have to meet the expectations, not just me, the folks here on the panel, but the entire community, that you're going to do what's necessary to be a good part of the community. Contractors, though. So I talked about students, faculty, and staff. Brian Russell, there's a question: who is to police the mandate of wearing masks when it comes to contractors on campus?
One of the things that I found interesting about contractors, we have lots of contractors on campus. It's not only who are building our buildings or coming in to replace a steam line or insulation or doing a project. So what we would like you to do is contact your Healthy at Work officer, and they will then contact the appropriate managing agency, the WKU people in charge of that particular area, and to ensure that they understand that everybody, visitors, contractors, students, faculty, we do wear masks when we're inside a building.
Great. And Brian, I'm going to stick with you. We have another question. Parenthetically, they're saying this is paraphrased from what seems to be a bit of a larger question or comment. Restart plans indicated that traffic flows inside buildings might be altered. When are those plans going to be finalized, and where can you find them? I added that. We'll look at stairs, hallways, bathrooms, entry, exit, student movement within classrooms. And then a point that I'll pick up on afterward that says departments need to pick up where central strategies end. But why don't you talk about the work that's already gone into that, Brian?
Well, we have taken a look at a lot of buildings, and where we're having points of sale, points of service, where we have people, we have put things on the floor to please stand here, to help people understand social distancing, staying apart. We've also learned that contact time is you have to be somewhere with somebody in direct contact closer than 6 feet for a period of 15 minutes before our public health department considers that a true contact. So stepping away and continue to be separated from one another, wearing your mask inside, and the casual walking past each other should not be a problem. Going up and down the stairwells, going up and down hallways, walking to in or out of the restroom area.
Thank you. And the second part of the question or the comment talked about the need for departments to pick up where central strategies end. And I think that is a terrific point. We've had restart committees, we've had a task force, hundreds of folks have been looking at this for 5 months. But the reality is that plans are only as good as first contact. And as we begin to welcome more folks back to campus, as Brian said, there have been hundreds of folks in DFM here since May. There have been other leadership organizations opening in a small way, members of the cabinet, starting on June 1. We did a soft opening in some areas in July, but now is when the bulk of folks will begin repopulating campus. We can't do all of this at the center. As a matter of fact, the restart plan is designed to provide guidance. And if you have questions, certainly we're happy to continue to answer them. But some of this responsibility really is going to fall upon faculty, staff, departments, colleges to execute for each of their areas. We can't do it all from the center, and I know no one's asking for that. And so what I hope you hear today is information, answers, and empowerment. Again, this is not going to be us in the task force doing all this work. It's actually the entire community that will work together to ensure that we're able to maintain what we're doing and to fulfill our mission. We're certainly here to support you, to guide you, to provide whatever you need. I think there was a question that came in not through this process before, but how do I make sure that I've got the cleaning supplies necessary to be able to disinfect my hands or have sanitizer? And Brian, do you want to talk a little bit about that? I know that we've delivered some portion of those, but then we have a process to refill them.
One of the things we've done is that every primary building entrance, we had fabricated, made, and have distributed close to 300 hand sanitizing stations. And we've identified some, we're getting ready to distribute about another 80 some units across campus. Every day our ESAs have been given the task to inspect those, to make sure that they are full and continue to be full. So the hand sanitizer stations that are required for our minimum Healthy at Work, they are in place, they'll be in place, and they'll be maintained by the facilities department. We've also distributed, we've made plans and have created, I think, about 1,000 disinfecting kits. And the things about the disinfecting kits, those have been put out to all the departments that have made requests using the PPE form that has been located on our WKU Restart, Big Red Restart page. and that's under your faculty and staff resources. That is still open for people to put in. I think this last week I got another 15 or 20 of those requests in. They're being reviewed by our Healthy at Work officers, and then they're going to, then they're distributed to the contact person. So the way we're going to keep those fulfilled through the semester is that we are going to work with the person that the department has dedicated as the contact point, and we will on a weekly basis restock those areas through that person. And if they are short, they contact the facilities department and make a request that we are lacking supplies. We have those supplies at purchasing, and we'll be able to quickly get that to you in your department.
I had something.
Sure, sure.
So early in the summer, we were asked by Brian's area to think about what it would look like when we reopened. And that was the academic offices mostly. And in doing so, many of the colleges and many of the departments thought about what it would look like when students came back to campus. And, you know, was their office appropriate for students to walk into? Was it a small office where they needed to have a plexiglass window? Or was it big enough that a student could come in the door and talk to people and that would be safe? Through that process, many of the colleges and many departments have also taken the opportunity to rearrange or reconfigure their classrooms. So a lot of the work that was asked about in the questions has already been accomplished because people have thought about what it's going to look like when there's traffic and what direction people should walk. And some of the buildings already have arrows on the floor and have designated exits and ways to go up and down the steps and stuff like that. So I think that where the question implied maybe when are we going to start this, I just wanted to say that a lot of the work has already been done and people have been thinking through how that's going to look and so we can operate safely.
Thank you, Cheryl. And again, if you are missing something that you need, it's not going to magically show up. We need to know that you're either out, and so work for your Healthy at Work officers. Those folks are important. They're ready, and you know, we built these request forms so that we're able to be responsive and make sure that folks have what they need to keep their areas cleaned and disinfected. In addition to the extra cleaning that we're going to have, the individual responsibility that goes along with that, making sure that we have all the pieces in place for us to be successful. This is another human resources question, and I'll ask Susan Hallworth on this one to take the lead. The question is, what recourse do we have if a supervisor comes near us without a mask or does something else that makes us feel unsafe?
So my initial thoughts on this were, for example, if one of my employees came up to me and I didn't have a mask on, I would hope they would feel comfortable enough to ask me, Susan, did you forget your mask? Could you put your mask on? But I understand that not every employee has that type of relationship with their supervisor. So what I would ask in that situation is that, again, you contact your Healthy at Work officer for your area, and we would address it through those means. Again, I would hope that many of our staff have a relationship where they could ask their manager to put a mask on, but I understand not everyone has that type of relationship.
Thank you, Susan. And folks have heard the governor use this and us use it in much of our communications, that we really are all in this together. It's going to take each of us and a little bit of grace too. Grace for folks that might not be comfortable, might not have realized, might have lost their mask. We're all trying as hard as we possibly can. And sometimes folks have a bad day. If they need a temporary or a mask or a disposable mask, we're make sure those are around too. But taking care of each other is important, and doing this with grace, I think, is also important. Cheryl, this question is for you. I'm guessing it does come from a faculty member. It's a bit of a long question, but this past weekend, I had a headache, congestion, and felt very fatigued. I've had bad seasonal allergies, so under normal circumstances, I just assume my allergies are worsened due to high humidity, move on with my life. However, I would like to visit with my parents, both with multiple underlying health conditions, before classes begin. So I had a COVID test at the CVS clinic on Tuesday morning. I would encourage you to get your test now, starting today here on campus. You're going to get a quicker turnaround. But this person still does not have the results from the test as of, I'm guessing, last Thursday or Friday. My question is, during the semester, if faculty start experiencing any symptoms of COVID, which are similar to severe allergies and the common cold, should we move our courses online pending test results, or should we continue teaching and only move the course online if we get a positive result? Results are taking from 6 to 14 days in many states. Hopefully we're going to be much quicker here with the arrangement we have with Graves Gilbert. This person later learned that other clinics are providing results more quickly. Yes, like we will. But this person also worries that if testing capacity becomes overwhelmed during the semester, we'll have a lengthy delay to get those tests. So what advice do you have for this faculty member, Cheryl?
I think absolutely, if you are at all concerned about being infected enough that you would go and get a test, then I think that you should move your class online for the time that you need to until you find out the results.
Great. And Cheryl, I'll stick with you on this one. It's really around modalities and selection of modalities. I continue to be proud of the way in which we navigated the situation, allowing faculty to have a choice of how they taught their courses and the way in which they taught them. Also creating choice for our students, some of whom want to be online, some of whom want to be here face-to-face or hybrid. The question is that we selected our class modalities before WKU's testing plans were revealed. Now that it's clear university is not going to do preemptive testing, or only test people who are symptomatic or identified in contact tracing, they suggest that there's a risk to faculty. So at least higher than what they would have anticipated at the time they made their selections. This faculty member asks, can they change their modality selection to reflect their increased risk? Asking about moving from face-to-face or hybrid to online.
I would ask them to discuss it with their faculty, with their department heads and the dean. In every case, almost every case that we've heard of where people have requested changes to modality, they've worked it out at the local level, at the department level, and we would ask them to continue to try and do it that way.
I'll dovetail on the safety. Given all the work that we're doing, I know that there always will be concerns, and again, nothing is without risk. But what we've created here on campus, I would argue, living on campus, likely to be safer than living in an apartment on campus. I think our instructional capacity and the places that we're going to teach will be distant and safer than perhaps other instructional spaces that you might see. Our dining, for example, we are confident that what we've created will be safer than going off to eat at a local restaurant. And so I'm confident in telling faculty, staff, and students that our environment here on campus is safer than just about anything else you're going to be able to find in the local community. But I also understand the control around staying at home and being able to isolate there. And so again, we're going to work through this together. We've worked really hard to create a space for our faculty, our staff, and our students that is as safe as possible, but it is not risk-free, and we want to make sure that we're attuned to that as well. Susan, this one is for you. If many classes are going to be online instead of in person, and of course it's a parking question, will the cost of parking permits go down since I won't need to be physically on campus as much? Parking, always a university issue.
Sure. So I'm working with the parking department on this very issue now. Typically, we would issue a full refund on the first day of class. We've changed that now to with no questions. So now we've extended that through the first week of class with no questions, and then working on an exception on a case-by-case basis. There's probably going to be some changes to that as we move through this over the coming weeks. So again, as we talk about, we're all trying to be as flexible as possible. What we have to remember is that the parking department is run by its own generation of revenue. So that has to be taken in consideration as well. But again, we've already eased up the policy and we'll be refining it over the coming weeks.
Thank you, Susan. David Oliver, this one is for you. I have a couple that are going to come to you. Number one, I've seen the information about quarantine procedures for students who are living on campus. However, is there any type of support the university will be able to provide to the students living off campus when they need to quarantine? Will there be any way to ensure that students who should be in quarantine stay in quarantine? So David, I'll toss that to you.
Well, I'll address those. Students that live off campus, if they're asked to quarantine or directed to quarantine by public health, we will provide services such as academic support and other things right along with how we would with any student. Obviously, the support of on-campus support of meals and other things would not be practical in those cases, but we obviously will work with them to make sure they don't that they have continuity of their instruction and other things through academics, and if they need assistance linking them to healthcare or other things, we can obviously do that. To the second point of the question, you repeat the second part, I'm sorry.
Will there be any way to ensure students who should be in quarantine stay in quarantine?
Yes, the quarantine process is going to be handled by the public health department. And if you are ordered to quarantine, you will have an official quarantine order from the health department, and they will deal with enforcement with that.
Might even show up at your door, knock to make sure you're where you're supposed to be.
Anything's possible, yes.
I'm going to continue with contact tracing, some questions there about what constitutes a contact that would require someone to go into quarantine. And if a student who attended a class in person tests positive, will everyone in that class need to quarantine? David?
A contact is defined by public health as being within 6 feet of an infected person for at least 15 minutes. Going back to our plans to reduce density of classrooms, to socially distance in the classrooms and in other areas, dining and across campus, our goal with that is to eliminate potential contacts physically by putting those things in place. And I think that's where we get back to, if people wear the mask, they keep the social distancing, we should, if everybody follows those rules, we should have very few contacts in our normal day-to-day activities.
And continuing with that, if there were students who tested positive in a face-to-face class, would the faculty member be notified there, not by identifying detail of their name, but just that someone in that class had tested positive? Is that going to be shared with the faculty member?
The public health department will make those contacts. We will not have that information per se. They handle that because of the HIPAA and other regulations are in place. Public health will deal with that. If they believe that there is a contact and they err on the side of caution, if they feel like that there is, they will contact them personally. And we will not be able to share that kind of data across the board. But public health will follow each case, and they will notify everyone that's potentially a contact in their eyes.
So I'm going to see if I can answer the next question that comes. That I advise a student organization, can we require students to commit to telling us if they test positive as a requirement to being allowed to come use our office space and computer lab? Are we allowed to tell our coworkers and other students in our organization? Or is that a FERPA violation? Sounds like a HIPAA violation. That's not something that we would really want to do. One last question that just came in over the transom. And Susan, I think this goes to you, but it may not. When will campus services, in particular postal services, return to more of a normal format, and what will that format be?
Okay, so over the past few months, as we've dealt with the pandemic, postal services, for example, went to just a skeletal staff and basically had hours a lot like what we have over the holiday break. So we've already revised that schedule, and we're open now 3 to 4 days a week. I think what we'll have to do as far as when we open 5 days a week is just monitor traffic and see what's best for the university community. Other services, I think it's just going to be dependent on area, but I think that this is a different normal. It's not going to, we've got to all remember, campus is not going to look like it did last fall. It's going to look different, but we want to make sure that the services are there so we can conduct business and of course, service our students.
Thank you, Susan. And thank you for participating today. Your input and your engagement are evidence that we will have a successful restart and that we're all working together. I do want to say this. This year will not be like any other year that you've experienced or any of us have experienced. We've all worked hard to create an environment where we can come back and fulfill our mission. And we have young people and not so young people who desperately need to be here. We know what our undergraduate population and our graduate population looks like, and many of them need this physical place to be available to them for them to have the best likelihood of succeeding, persisting, and get a degree. It requires each one of us to do our part. And so in advance, before we actually restart, let me thank you for everything you've already done. I know hundreds of hours outside of normal work, rethinking everything that we do has been part of your summer as it's been part of all of ours. And 5 months ago feels like a million years ago and 10 minutes ago. And so for all of the work you've done, let me say thank you. If we didn't get to your question today, we're going to continue to update the frequently asked questions on the wku.edu/healthyonthehill site. And for all of you participating, thank you for taking the time out of your schedule to be part of this. We appreciate you. We're looking forward to a great restart, and go Tops!